Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Nephrin molecular series or edition. This audio podcast as part of the tornado PlexAR. This audio podcast as part of a monster Bostics, and this audio podcast as part of a Storm Robotics production. In this audio podcast will now sort of delve into looking at pharmacotherapy specific and around pediatrics in line to pediatric nephrology. So, in looking at pharmacotherapy or pharmacology aspects. So research surrounding drug targets, formulations, and pharmacotherapy are important to understand for pediatric specialists. There is a broad-ranging number of targets, including G-coupled protein receptors or GPCRs, enzymes, hormones and growth factors, ion channels, nuclear nuclear hormone receptors, and DNA. There are still drug targets that are unknown. It sort of reaffirmed that young people with varying forms of CKD or chronic kidney disease varying forms of chronic kidney disease or CKD are generally immunosuppressed or immunocompromised, and drug uptake and activity is an ongoing concern. More evidence is also becoming is also sort of has also sort of been evidence amongst the literature for the use of cytokines as drug targets for T cell tolerance, for example, post transplantation, and investigators are invited to look at the works historically, and as published works from sort of 2000, early 2000 up to 2010, and more sort of recently, for an understanding of cytokines as drug targets. Best practice can only be achieved if nephrologists or specialists can relate sort of treatment or regimens through implementing pharmacotherapy based systematic reviews, critical appraisals, and meta-analysis citations for comparisons amongst treatments. The entity should be upheld in pediatric renal care, in amongst renal care. And there is now sort of an increasing importance of raising CKD as a chronic kidney disease or CKD awareness for young people, and sort of amongst parents and guardians. And this can only happen if there are more sort of if there's more of a sort of where perspective works for specialists, link works to patient focused dimensions accordingly. So that draws this audio podcast to a close. This audio podcast, as part of a Nephrin molecular series, as part of a Nephrin a Nephrin molecular audio podcast sort of edition. This audio podcast as part of a tornado plexar. This audio podcast as part of a monster Bostics, and this audio podcast as part of a Storm Robotics production.